Ms. Jackson, please share with us what type of symptoms you had initially before you came in to see us.
I had headaches all the time.
Yeah.
Um,
What was the intensity of those headaches? 0 to 10,
uh,
10 being the worst.
well, they would go up to a 10.
10, very severe.
Yes.
Okay. And what were you doing to manage those headaches?
Sometimes I have to go to the hospital and get an IV and go home and sleep for a couple of days.
Okay.
Other times, when they were not as severe, I would just lay at home on the couch for days at a time.
Wow. So it was really impacting you.
Yes.
Like you couldn't do much when you had those headaches.
No,
And what
I
did your
was
doctor-
sick more than I was well.
More bad days and good days.
Yes, sir.
And what did your doctor do to manage all this? They gave you
A
medication?
lot of medication.
Okay. And it didn't really help that much.
No.
Okay. And what other symptoms did you have in addition to headaches?
Well, that
What were you diagnosed with?
a chronic migraine,
Okay.
but I also had hypothyroidism.
Okay.
So
Dystonia, do they call it?
cervical dystonia.
Okay. Yeah.
Yeah.
And so 6 months into our program, what type of improvement have you noticed so far?
A big improvement. I feel a whole lot better now. I have more good days than I do bad days, and I haven't had to go in and get an IV during the whole time that I've been coming.
That's great.
Yes.
And how about medication-wise? Are you taking less?
I'm
more?
taking less medication, hopefully to even come off more of my medication.
Okay. And then how many percent improvement would you say was in your headache level?
Probably 75%, maybe 80.
Right. So like this past month, you were mentioning that you were doing really well with them,
Yes.
like the best in a while.
Quite a few years.
The best you felt in a few years.
Yes.
Okay. And how about energy level?
A lot more energy.
How many percent improvement have you noticed in that area?
Probably 75 to 80%.
Okay. And did you have bodily pain as well before?
I did. I had tailbone would hurt.
Mhm.
I had a pain in my side,
Mm-hmm.
and that's gone. My tailbone doesn't hurt as much as it did.
And these are symptoms that you have for how long? These headaches and things?
8 years.
8 years.
Well, I've had migraines since I was a teenager, but this chronic migraine that I started getting happened 8 years ago.
Wow. So for 8 years, nothing was really shifting.
No, I would go through times where I would feel better,
Yeah.
and I would have a stretch of good time, but
Yeah.
for the most part, no, I have had headaches the whole time.
Right. So definitely this is a big change, a big improvement for you.
Big improvement, yeah.
Now, just for the icing on the cake, how much weight did you lose?
About 26 pounds.
That's great. That
Yeah.
helps.
Yeah, definitely.
So what would you say is the biggest difference between our approach and the approach you tried before?
I don't take medication to make me feel better. It's I'm eating good food,
Mm-hmm.
so I'm on a better eating program, and it's I don't have to take a bunch of pills to make me feel better.
Right. So it's a combination of therapies in the office and teaching you how to eat differently and taking the right supplements.
Yes.
That's kind of putting it together for you.
Yes.
Okay, great. So would you recommend this program to other people who may be, having chronic issues and looking for answers?
Yes. I would highly recommend it.
Okay, great. Thank you so much, Ms. Jackson.
Oh, you're welcome. Thank you.